Which of the following best defines the anatomical criteria for double outlet right ventricle, DORV? A. Both the aorta and pulmonary artery arise entirely or predominantly from the right ventricle. B. The aorta arises from the right ventricle while the pulmonary artery arises from the left ventricle. C. A large ventricular septal defect, VSD, with 50% aortic override. D. Failure of the tricuspid valve to develop, leading to a hypoplastic right ventricle. Answer: A. Both the aorta and pulmonary artery arise entirely or predominantly from the right ventricle. In the Taussig-Bing heart variation of DORV, what is the relationship between the VSD and the great arteries? A. Subaortic VSD. B. Subpulmonic VSD. C. Doubly committed VSD. D. Non-committed, remote, VSD. Answer: B. Subpulmonic VSD. Which clinical presentation is most common in a patient with DORV and a subaortic VSD without pulmonary stenosis? A. Severe neonatal cyanosis. B. Isolated upper extremity hypertension. C. Congestive heart failure due to large left to right shunt. D. Hypercyanotic TET spells. Answer: C. Congestive heart failure due to large left to right shunt. A patient with DORV, subaortic VSD, and pulmonary stenosis clinically resembles which other congenital heart defect? A. Transposition of the great arteries. B. Tetralogy of Fallot. C. Hypoplastic left heart syndrome. D. Total anomalous pulmonary venous return. Answer: B. Tetralogy of Fallot. What is the most common type of VSD found in patients with DORV? A. Subpulmonic. B. Doubly committed. C. Subaortic. D. Muscular. Answer: C. Subaortic. The non-committed or remote VSD in DORV is typically located in which part of the septum? A. Inlet or trabecular septum. B. Outlet septum. C. Membranous septum. D. Infundibular septum. Answer: A. Inlet or trabecular septum. Which echocardiographic finding is a hallmark of DORV that distinguishes it from tetralogy of Fallot? A. Presence of a VSD. B. Mitral aortic valve discontinuity. C. Right ventricular hypertrophy. D. Overriding aorta. Answer: B. Mitral aortic valve discontinuity. What is the primary surgical goal for a simple DORV, subaortic VSD without PS? A. Fontan procedure. B. Arterial switch operation. C. Interventricular tunnel repair, baffle. D. Pulmonary artery banding only. Answer: C. Interventricular tunnel repair, baffle. Which chromosomal abnormality is most frequently associated with DORV? A. Trisomy 21. B. Turner syndrome. C. 22q11.2 deletion, DeGeorge syndrome. D. Williams syndrome. Answer: C. 22q11.2 deletion, DeGeorge syndrome. In Taussig-Bing anatomy, why is an arterial switch operation, ASO, often performed? A. To close a muscular VSD. B. To redirect left ventricular blood to the aorta when the VSD is subpulmonic. C. To treat associated coarctation of the aorta. D. To increase pulmonary blood flow. Answer: B. To redirect left ventricular blood to the aorta when the VSD is subpulmonic. Which of the following is a common associated cardiac lesion in patients with Taussig-Bing DORV? A. Ebstein's anomaly. B. Coarctation of the aorta. C. Mitral stenosis. D. Coronary artery fistula. Answer: B. Coarctation of the aorta. A doubly committed VSD in DORV refers to a defect that A. Is located below both the aortic and pulmonary valves. B. Is located only in the muscular septum. C. Has no relationship to the great arteries. D. Is associated with a common atrioventricular canal. Answer: A. Is located below both the aortic and pulmonary valves. What determines the degree of cyanosis in a patient with DORV? A. The size of the right atrium. B. The position of the VSD and the presence of pulmonary stenosis. C. The patient's blood pressure. D. The type of atrioventricular valve involved. Answer: B. The position of the VSD and the presence of pulmonary stenosis. For a patient with DORV and a remote VSD that cannot be baffled to the aorta, which surgical pathway is often considered? A. Immediate heart transplant. B. Single ventricle palliation, Fontan sequence. C. Isolated VSD closure. D. Observation only. Answer: B. Single ventricle palliation, Fontan sequence. Which of the following is true regarding the conduction system in DORV? A. It is always in the normal position. B. The AV node is often displaced, especially in cases with an associated AV canal defect. C. There is no risk of heart block during surgical repair. D. The bundle of His is always located on the right side of the septum. Answer: B. The AV node is often displaced, especially in cases with an associated AV canal defect.